Hi, this is Abby, PGY2 Oncology Pharmacy resident, and I wanted to share with you all the results for my medication use evaluation that I have been working on for the past couple of months. The title of this medication use evaluation is a retrospective review of long-acting granulocyte colony-stimulating factors for the prophylaxis of chemotherapy-induced febrile neutropenia. Co-investigators of this study are JMO and Victoria Prince. For background of this study, neutropenia is a side effect of myelosuppressive chemotherapy that can increase the risk of infection in cancer patients. Specifically for this medication use evaluation, I evaluated the rate of grade 3 febrile neutropenia and grade 4 febrile neutropenia. This is a really important matter because febrile neutropenia can lead to many consequences. It can lead to hospitalization, as well as chemotherapy dose delays and reductions, and an overall decreased quality of life. Granulocyte colony-stimulating factors, such as filgrastim and pegfilgrastim, promote proliferation and differentiation of neutrophils, thus decreasing the incidence of febrile neutropenia. In March of 2019, Monument Health Cancer Care Institute transitioned from Neulasta Onpro to Udenyca as the preferred colony-stimulating factor product. At our institution, the current standard of care is for patients to receive their chemotherapy and then return next day to clinic for administration of the colony-stimulating factor. However, due to caveats and circumstances surrounding the COVID-19 pandemic, in March of 2020, the preferred colony-stimulating factor product was transitioned back to Neulasta Onpro in order to limit patient clinic exposure. Objectives for the study are as follows. The primary objective included evaluating the rate of grade 3 or 4 febrile neutropenia associated with next day administration of colony-stimulating factors for Udenyca and Neulasta Onpro, and also performing a value analysis on the use of colony-stimulating factors and comparing treatment costs of Udenyca versus Neulasta Onpro. For the methods of this study, this was a retrospective observational chart review. Data was collected via the electronic medical record. The dates of collection were January 1st, 2017 to July 1st of 2020. Patients were included in this study if they were 18 years of age or older, and they had non-myeloid malignancies receiving myelosuppressive anti-cancer drugs associated with a clinically significant incidence of febrile neutropenia, and they were also receiving prophylactic Udenyca or Neulasta Onpro. Patients were excluded from my study if they received pegfilgrastim greater than 48 hours after chemotherapy administration, or pertinent lab draws were drawn greater than 48 hours before the next chemotherapy cycle. Patients on concurrent antibiotic therapy were also excluded from my study. Points of data collection include age range, gender, malignancy type and stage, the colony-stimulating factor product that was used, as well as the date of administration, the ANC at baseline and throughout chemotherapy, if there was febrile neutropenia hospitalization, and then the incidence of grade 3 or 4 febrile neutropenia while receiving a colony-stimulating factor as prophylaxis. When looking at the outcomes, there was a total of 150 patients that I included in my study. 107 or 71% of the patients were female. The most common age range was 61 to 70 years of age, or 31%. The most common malignancy type was breast cancer, with 71 patients, or 47%. When we look at the individual product usage, 92 patients received Neulasta Onpro, or 61%. 58 patients received Udenyca, or 39%. Overall, for febrile neutropenia, 8 patients experienced either a grade 3 or 4, and this equated to 5%. Grade 3 febrile neutropenia while receiving Neulasta Onpro was experienced in 2 patients, or 1.3%. Grade 3 febrile neutropenia while receiving Udenyca occurred in 4 patients, or 2.7%. Grade 4 febrile neutropenia while receiving either Neulasta Onpro or Udenyca occurred in 1 patient each at 0.7%. Other observations include the overall febrile neutropenia rate, which was 5% for this study. And although we can't compare this directly to other studies, There was a study published by Kaufman and colleagues that reported an 11% incidence of febrile neutropenia in breast cancer patients while they were receiving doxorubicin, cyclophosphamide, and docetaxel. So again, although we can't do a direct cross comparison, it does give us some perspective that our overall febrile neutropenia rate is quite well within Monument Health. When we look at the value analysis, the cost expenditure on Neulasta Onpro was $231,196. The cost expenditure with Udenyca was $87,232. If 100% of the patients would have used Udenyca, there would have been an estimated cost savings of approximately $92,828. Conclusions from this medication use evaluation include the use of the biosimilar Udenyca demonstrates safety and efficacy similar to that of the originator product, and also it is evident that significant cost savings can be acquired by adopting the use of biosimilar products. Thank you all for listening.